Well, it's time for another Medicare Supplement rate update. This is important info for those who are existing Medicare Supplement policyholders, as well as for those who are turning 65 and or considering getting a Medicare Supplement policy. In this video, I will review rate increases and even one rate decrease from the following companies: AARP, UnitedHealthcare, Aetna and its subsidiaries, Cigna, Humana, Mutual of Omaha and its subsidiaries. At the end of the video, I'm going to give you a serious warning about why you may want to avoid certain Medicare supplement carriers. One thing you will clearly see is that over the last few years, the rate increases on open blocks of business have continued to rise each year. If you look at this chart, it shows how the average annual Plan G premiums have increased over time. You clearly see that from 2023 to 2024 to 2025, a very sharp increase as compared to 2019 to 2023. CSG actuarial states, quote, "As displayed above, higher rate increases on Plan G and a slowing of new market entrants has caused the average Plan G premiums for the lowest 5, 10, 15, and 20 carriers in the market to increase substantially in 2024 and 2025, unquote. And this chart shows the average annual percentage changes in premiums. Once again, look at 2023 to 2024 to 2025. Hi, I'm Chris Prang, the Medicare analyst. I'm a licensed agent in 16 states, and I am based out of Charlottesville, Virginia. Maximizing your Medicare should be very important to you, and my goal is to help people like you make a wise and competent decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. Before I get started, if today is your birthday, Irma Bombeck said, "A friend never defends a husband who gets his wife an electric skillet for her birthday." So let's go over rate increases by company for in-force blocks of business. These rate increases are not necessarily across the board on all the different plans the insurance company has within the state. So take these as either an average of all their plans or what was reported for a particular plan, like a Plan F or a Plan G. So AARP, UnitedHealthcare, went down 2.6% in Maryland, woohoo, but 15.1% up in Texas. ACE went up 16.2% in Ohio and 16.4% in various states and plans. ACE is ceasing Medicare supplement sales, and I'm going to address that later and why it matters. Aetna is up 12.5% in Colorado, 13.6% in Missouri and Rhode Island. Their American Continental is up 7.5% in West Virginia. Their Continental Life is up 13.1% in Nebraska and Virginia and 20% in North Dakota. And their SilverScript is up 2.6% in New Hampshire. Cigna, which was recently sold to HCSC, Healthcare Services Corporation, and will now be going by the name of HealthSpring, was up 7.7% in California, 10.6% in Nebraska and Washington, 8% in Kansas, Nevada, and Tennessee, and 11.3% in various states and various plans. Humana is up 7.9% in Kentucky and Oregon, 5.2% in California, South Dakota, and Wyoming, 11.6% in various states and plans, and 8.1% in New Jersey. If you've seen any of my previous videos with the Medicare supplement rate updates, one thing that is clear is both Humana and Cigna have had the most steady rate increases, meaning keeping them down. Yes, they're going up, but not as much as the others. Mutual of Omaha went up 21.6% in Texas, 7.4% in DC, Vermont, and Wyoming. Their Omaha Insurance Company went up 8.8% in Connecticut and Kansas. Their Omaha Supplemental went up 10.8% in Tennessee, and their United of Omaha went up 8.3% in Pennsylvania and Wyoming. And their United World Life went up 15.6% in Missouri. Now, you may be asking, why are rates going up so fast? I've addressed this in previous videos, but if you haven't seen these, and the answer is due to increased utilization of benefits, meaning more people are going to their doctor, more people are getting medical services, so therefore the insurance companies are having to fork out more. Healthcare inflation, as we have addressed in previous videos as well, having to accept more and more people due to guaranteed issue rights. This is a big one. This would include all the birthday rule states that are coming fast and furious. This rule mandates that an insurance company cannot decline anyone with an existing supplement due to any previous, current, or future health issues, and having to accept people coming off of a terminated Medicare Advantage plan. There are a lot last year, and I wouldn't be surprised if there are a lot coming in 2026. So what can you do? One, if you are new to Medicare and or considering a Medicare supplement for the first time and you are relatively healthy and don't frequent medical services all that often, then at least consider a Plan N over a Plan G. As we have seen in previous videos, the Plan N goes up at a slower rate normally, so over time your savings will get greater and greater. Two, if you have a Medicare supplement and the rate is getting out of hand and you are relatively healthy, then consider applying for a new Medicare supplement at a lower rate. Perhaps you have a Plan F now, then consider going to a Plan G or Plan N. In most states, you do have to go through medical underwriting to be approved. As mentioned, a number of states have a birthday rule where you can get a new supplement guaranteed around the time of your birthday. Of course, the rate has to be less enough to make it worth your while. And more states are passing birthday rule laws, Virginia being one of the most recent ones. I think you will see more states doing this. The bad news about birthday rule states is that everyone in the end pays more. You may be saying, Chris, I just can't afford the premium anymore. I don't live in a birthday rule state, and I certainly will not get through medical underwriting. I understand. If that is the case, and you have adult children, my first suggestion is ask them to help start covering your premium costs. After all, you likely forked out a lot of money for them at one time. They likely owe it to you. Three, now if you are really healthy, maintain your health, you like to eat really well, exercise, get plenty of sleep, etc., then you could consider a high deductible Plan G. These typically go up very slow. I've done several videos in the high deductible Plan G. It is Medicare's best kept secret and the best alternative to a Medicare Advantage plan. And you can check out my other videos to learn more. And if you're in New York, well, then almost everyone should consider getting a high deductible G in the first place because the savings are huge. Number four, the last thing you can do other than bite the bullet on the high and increasing premiums is to very carefully consider a Medicare Advantage plan. But again, be careful. Sure, you can get a Medicare Advantage plan for $0 per month, and that might be $200 to $400 less than your Medicare supplement. But what happens if you start going in for lots of treatment or hospital stays? Your co-payments each month could easily exceed what you were paying in premiums. If you decide to switch to a Medicare Advantage plan and you've never had one before, then you have a 12-month trial right where you can get your supplement back guaranteed. And guess what? You might, and I mean you might, end up with a lower rate than you had before. All right, that's it for today. I do hope that you found this helpful. If you have any questions about what I've just gone over and when you're ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see here, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and philosophies and budget. I will do my best to answer any questions or concerns that you may have, and once we determine what's best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice, and of course be available down the road for your support. To stay up to date and gain more insight on maximizing your Medicare insurance, then please go ahead and subscribe. And who do you know who may benefit from this information? Please share it with them. Okay, as promised, the last thing. A number of companies over the past few years have come into the Medicare supplement market. Two of them have already pulled out due to high medical loss ratios. Those companies were Allstate and ACE, which is a subsidiary of Chubb. Chubb, ironically, is starting a new Medicare supplement through their other insurance subsidiary, Independent Insurance Company of North America. Manhattan Life has also pulled out, but they had been in the Medicare supplement market for years. Why does this matter to you? Because when a company pulls out, then they no longer have new and younger policyholders coming in to help offset the older policyholders' claims. You end up with what is called a dead pool or a closed block of business. When this happens, premiums typically, but not always, go up even faster. Now, you shouldn't have to worry about them paying claims, but you may be concerned about how fast your premiums will go up in the future. If you happen to be in a birthday rule state, then it's not too big of a deal because you can get out of it. If you are not in a birthday rule state and you are in good health, then you may want to at least compare rates at some point and then switch if it makes financial sense. If you need a rate quote and you're from one of the states I'm licensed in, then please reach out to me. While I do represent some of these companies that have not been in the market very long, I'm presently hesitant about recommending them over another carrier that has been established for a longer period of time. Again, if you need my help and want to work with me, just reach out. I'm Chris Prang, the Medicare Analyst. Make it a great day.